Botox. Whenever you think of aesthetics or anti-aging or beautification, the first thing comes across is Botox, right? Because it's such a popular thing. And that's what made aesthetics popular in a very maybe infamous way. So when we talk about Botox, the questions that I get is it safe? Should I be ever touching it? Will it paralyze my face? Will it make me look weird? How long does it last? How young can I start? Is it safe? All these things, right? Multiple questions. So there are a lot of snippets on my Instagram that I keep posting to educate, to say when you can do it and when you can't. But I thought let me do a detailed video for those who are really interested to get a little deeper. So here's that video for you. Now, before I tell you what is Botox, let's tell you about how a muscle contracts. Do you know what Botox is used for, right? Botox is used for active lines on the face in a more simpler term. I'll tell you where we use it even more a little later. How do lines form on the face? Muscle contraction leads to those lines. Now on the face, the muscles of the face are attached to the skin, while muscles on the body are attached to the bone itself. So therefore you don't end up getting wrinkles when these muscles contract, but of course there are fold lines in various places. But on the face, each time the muscle contracts, it pulls the skin with it because it is attached to the skin. So those lines keep forming. For example, the muscle around the eye, which is called as orbicularis oculi, is a round muscle like this. So when you contract like a purse string, it pulls all of them together and you get exactly the lines like a purse string, right? When you contract the mouth, for example, it's orbicularis oris, which is around the mouth, which is a round muscle with fibers going round and round. So when you do ooh, you end up getting lines like that. So whenever the muscle contracts, along with the line of the muscle fibers, it contracts the skin and you end up getting the muscle lines. Now when you do a rifted brow, this is frontalis. It's a big muscle which contracts like this to pull the muscle up, eyebrow up. So you get these lines. So along the direction of the pull, you end up getting lines across the direction of the muscle itself. Yeah, direction of the pull is where you end up getting the lines. So now our aim is to ease the unwanted lines. For example, the forehead lines or lines around the eye, or when you frown. No, I can't frown. I have Botox it because I love Botoxing this. Nobody wants a frown line. So there are three muscles which actually contribute to bringing it in. So therefore the lines are formed. So we don't like those lines, the ones who don't like it and ones who want to address it. The only sure shot magical treatment is Botox, or rather botulinum protein. There are many companies who make it, like Xeomin makes it, Xeomin has it, which is made by another company. So various companies makes this, and what I usually use in my clinic is something from Allergan, longest staying, it's used widely around the world, a lot of clinical research, a lot of papers, a lot of experience of multiple doctors around the globe. So for me, in my hands, I find this fabulous.
Analyzing their needs and working on them.
So I know exactly what I do and what I get. So therefore I stick to using this. Now that's just my personal opinion. How does this Botox work on the muscle? How does a muscle contract? I told you how the lines are formed. Now we need to know how does the muscle contract. So from the brain, the nerve carries, when you say you have an idea or you have a command to say close my eyes, the nerve carries this command to let's say the muscle which makes it happen. So the nerve comes in, if this is the muscle, nerve is here, brain has released, so travels the signal here and it has to tell the muscle now contract. How does it do it? There's a chemical called acetylcholine that is released from the nerve ending, and there is a little cup-like thing which is a receptor here for the muscle. So when these two meet, the chemical, let's say, pours into the cup, the muscle knows and it contracts. Now what if I block that cup? That's all is what Botox does. So new cups develop around, so eventually Botox doesn't work, which means to say it wears off, not doesn't work, it wears off. That's how the action is limited to anywhere around 3 months plus or minus a few weeks here and there. That's how it works. So it is not cutting your nerve, it's not paralyzing your nerve, it is not damaging your muscle, nothing. It is just making that receptor not so sensitive to the chemical that it is supposed to be sensitive to. Eventually more receptors grow, that's how body is. Yeah. So now you understand how Botox works. Now what we are doing with it is take it, of course Botox is a powder. We dilute it with fluid and then inject it into a patient's face. Depending on which muscle I am using, various calculations that I end up doing. What are the other muscles around that area? We decide the dose, and that is picked up in a syringe, which is the insulin syringe, we call it. It's the finest needle, and we inject it into the said muscle, said doses at a particular depth depending on how big the muscle, deep the muscle, superficial, we decide all that. So it's injected. Is it painful, the injections? Not really. You've seen the elderly in the family or the diabetics in the family, if at all, inject themselves with insulin, right? So that's why it's called the insulin needle. Very, very fine needle. It really doesn't hurt. And for the ones who are very sensitive, I even put a numbing cream for a while. So it's like a zero pain thing. So that's how it is injected. How often should we inject it? Once in 3 months. But larger muscles, you can inject once in 4 or 5 months. Smaller the muscle, smaller the dose, you need to inject it more frequently. For example, there's a tiny muscle, the orbicularis, the face, the eye muscle that I told you. When it contracts, not only does it cause these lines, it also pulls the corner of the brow down. Like if I do this, you see it goes down. If I release, it goes up. So I don't like this dip. So I usually use very little drug to just give a nice little open-eyed look to people. So when I do that, it's hardly some units. I use maybe 2 units if at all. So that comes back within a month and a half. But when we do for the masseter, we use a lot of units. So it's something that I only maybe redose after 4 to 6 months. So depending on the dose, you inject it frequently. Can you use Botox? One is clear for you that wherever the muscle contracts, there is line. So those active muscle contraction which forms lines, I can use, such as a frown line, a forehead line, a crow's feet, all of that you can use. Other places where you want to relax the negatively pulling muscle, like I said here, it is negatively pulling. The frown line, the muscles which cause frown line not only do this, they also do this. So you also want to push that out and make the brow nice. So I really like to do the frown lines. Then there's a sad look that happens, do this, there are lines which come here and this muscle pulls you down. It's called as the DAO1 muscle here. So you relax that, this doesn't get pulled down very in a hard and a wrong fashion. There's a large muscle called platysma which pulls the entire lower face down. I love to inject that so that your lower face is not tugged continuously. Very important. So these are more anti-aging Botox when you say, or make the effect of the aging much lesser and more graceful and more smoother. So we prevent that by using Botox in those areas. The other thing that Botox does beautifully for me is literally shrink the face or make the face smaller or more narrower and more better shaped. There are some people who chew a lot, or innately you have a stronger muscle which is a temporalis, we call it here, but you will see them having a bulge here. So that makes the forehead look very broad and man-like. So we like to use a little Botox for that, to ease that muscle, gives you a more nicer, smoother shape to the forehead. Then there is a masseter muscle which comes out. See, when I clench, it comes out. So for some people it really comes out. That makes the face very square and very bulky sometimes and very broad. In a woman you don't like it to be broad, you like it to be more narrower, but in a man you like it to be square at least, right? So seeing how bulky that is, we end up injecting that. Like a flare nostril, I do that. So when I do these three, face gets a beautiful shape and a narrow and a more aesthetic appearance. That's one use of Botox. So to contour your face. To lengthen the chin, I can use Botox also to relax this mentalis muscle. So you're contouring your face. You can sharpen the nose with Botox. You can pick up the nose tip with Botox. So these are all contour changes you can do with Botox. So first one was lines, second one was contour change. Third one is for indications such as migraine. But if I still stick to aesthetics, excessive sweating, hyperhydrosis on the armpits, hyperhidrosis on the face in certain areas, Botox works brilliantly well there. And no, there's no side effect, there's nothing that can go wrong with it. Now the other indication is simpler indications like open pore, repeated acne with no cause, micro or baby Botoxing gives you a much more alabaster kind of skin. So there are multiple indications for Botox like this. Now, is Botox safe? Yes, very safe in the hands of an expert. Why I'm telling you, this is something that you have to go to an expert who does a lot of Botox and filler practice. You can't go to someone who has less experience in this, because why is medicine called practice, right? Law, medicine, some fields are called as practice, right? Because we are practicing throughout our life. So we get better at it, more patients we do, we find out those little nuances which make it much better than somebody who has lesser practice. So it's important for you to go to someone who's called an expert this particular field. And then it's also very important because there is nothing which will erase if it goes wrong. If something goes wrong with Botox, there is no antidote. So it's very important for you to get it right every shot, not just the first shot. Every time there is no oops moment at all. That's what one of my patients used to say. I'm premium, or let's say I'm highly priced. So one of my patients was telling me, I'd rather do that and come to you rather than try to save a few bucks, go to someone and have an oops moment someday. The whole point is in the last 12 years that I've been coming to you, I've not had an oops moment, touch wood, touch wood. So God's been kind. So that is what we end up saying, go to a real expert. So what can go wrong? If the muscles are not chosen right, if the doses are wrong, you could have a brow drop, you could have a spock brow which happens. And some people, when you see, you can make out that they've done Botox, but certain areas get very stiff. So the other areas hypercompensate. You can have a lid drop. You could have an asymmetric smile when it's injected in the lower half of the face. You could have food logging in your lower lip if it is not done properly and other muscles are involved. So these are a few things which can go wrong. But all this only happens if you go to a untrained person, unqualified. There are a lot of people now, because aesthetics has become such a popular field, there are a lot of people who are not trained enough. So make sure they're qualified and they're trained. Very, very important. That's it. So Botox is such a magic. I just love doing it because sure shot gives you a beautiful relaxed look, doesn't give you a paralyzed look. At me, I don't look paralyzed. I'm 50 and I just of course do some Botox to my face. But anybody that I have worked even over the years, you cannot point out. The minute you point out, I always say it's bad work. So that's the whole thing. So Botox, not to be scared about. If you're thinking about it, go talk to your doctor, go talk to your provider, because it's such a beautiful advancement of science. Embrace it. No, I don't believe in removing every line. I keep my lines for the crow's feet. I love it. I think the smile lines look so pretty in so many people. So there are lines that I end up preserving. So that's where your doctor's expertise comes. And of course, what you want is the most important, not life-saving, right? So you should want it. If you want it, or people who want it, you need to know who to go to. Otherwise, it's like you want it, you want to do it, you may end up going to a not so great provider. That's also one thing. So to me, it's each one's choice. But if it is your choice to ease the lines, if it's your choice to use Botox, please be well informed before you go do it. That is all this video about. It is not advocating that lines are not aesthetic, nor is it saying that you need to go do Botox. To me, lines are beautiful. It tells you the story of the time. Some lines you don't need to have, frown you don't need to have, right? So then, how do you approach it right is all this video was about. So it's about the science of Botox and how it works if you ever want to do that. Take care and pass it on to whoever you think it's relevant, because a lot of things, because this is such a hush-hush subject, people don't talk and you don't know where to get the information and you don't know where to go. So here's all of these videos. Leave your comments below and tell me what's the next video you want me to do. Filler, of course, I'll do it, but get me more and I shall keep talking. Thank you.